Hi, this is Pat Iyer with Writing to Get Business podcast. I have with me today Pamela Rasheed, who is a nurse with a master's degree, who just released her first book. And I wanted to have her share her unique story with you in this podcast. Welcome to the show, Pamela.
Thank you so much, Pat, for having me.
I know that you've got a fascinating background, Pamela, of having come to this country from another country, needing to get established, find a place to live, get a job, all on your own with a couple of children. And you and I met through a course that I taught on teaching people how to write books. Let's talk about the topic that you selected for your first book and how you got to that vision that you wanted to write a book about it.
Well, first of all, I was going to write a book about my life story, how I came from Guyana as an immigrant, in my very early 20s, alone, and having to navigate the complexities of living in a big city, and all the difficulties I've gone through since childhood to where I was at the time, which was just a couple years ago. Been through the rigors, became a nurse, and did my master's degree, all through struggles. And that was the book I was going to write. But I was talking to a good friend of mine that I had met at the University of Guyana many years ago. And he was saying to me, he said, Pamela, but you have such a strong background in infertility and women's health. Why don't you write something about that? And I started to think about it. And little did I realize, he was really good, because for me to write about my struggles, no one knows who I am and who would be interested in me, a girl from Guyana. And so I started to think about it, and then the whole idea evolved. I couldn't sleep. I would think about this morning, noon, and night, and how to shape this book. Yes, I had the clinical background, how to add credibility to the book. And I've developed a lot of relationships with patients, when I worked at Columbia University, who've gone through egg and embryo donation program. And I've developed a relationship to the point where there was trust, And when I asked, would you be willing to share your struggles and all the hidden costs that you had to face to achieve parenthood? Would you be able to share that? And 10 out of 10 all said yes. Not one said no. And that was like I hit the jackpot there. And so I started to formulate the book. I read their stories, and then I needed to get an editor. My goodness, I have all this work here, all this valuable information. How do I shape it? It's not my cup of tea to really, I've never written a book. I read books, but I never written one. And then I was introduced to Pat through the National Business Nursing Association CEO, and I think that that is where everything took off. I came on to her class, and I realized that this is what's going to take all this information that I have and shape it into a book. And I decided to go with that. And it became a beautiful book. I wish I could tell you how it was transformed from the manuscript to the book. There was a lot of work, but I think it was worth it.
The vision of that book evolved from your area of expertise in a very narrow aspect of nursing, working with couples with infertility struggles. And I know that one of the things that we talked about was, who is this book for? Originally, when you wrote the book, you were thinking of, I want to reach nurses and doctors to talk about some of the medical aspects of this. And I also want to reach patients. Can you share with our listener how you decided to sort that out? Because you did pick one distinct pathway as you evolved the material.
Yes. Well, first, I wanted to, being in the field, I see how we're all focused on the diagnosis and formulating a treatment plan. And what was being left out of that is, the support for these women and couple who have to deal with stigma, relationship issues, marital breakdown, financial depletion. How do you build care to that aspect of the patient into the medical formulation and diagnosis and treatment outcomes? Um, I feel, and I'm a believer in holistic therapy, I feel that we need to take care of the whole person. So nurses can really, really be very effective if they would incorporate that approach into their care of patients with infertility as they can with other diagnoses. But that was the reason why I thought, well, I need to shed light on these hidden costs that these patients carry as a bigger burden sometimes. Because how are we going to pay the mortgage, but then afford the medications, which are very, very expensive? Um, you know, and then reading the patient's stories, it then got to, well, maybe there definitely are other women couples who can learn from the stories that were written for this book. How did the women in the book dealt with their difficulties? How did they get through? And I realized, well, this book is not only for the medical professionals, it's also for patients who are going through this. And then as I continued to read and I did some research and all of that, I figured, there is a whole lot of support out there for these women, their families, their friends, who can sometimes say the wrong things, and then they can say the right things. This book would help them to know what to say. Sometimes it's just sit in silence and listen, not say anything. So it just evolved in three parts. So I gave the clinical, which is part one in the book, the patient stories, and then I pulled out the hidden costs and I tackled those with my firsthand experience in coaching and mentoring and supporting these patients until they became successful. And I've said to my patients, you have not come to the end of your rope until you've met your baby face to face, whether it is with your own eggs and sperm, whether it was with donor eggs or sperm or adoption. Until you've met your baby face to face, you have not come to the end of your rope.
And I'm sure that that was a wonderful phrase for the people who thought this is going to go on forever and I'm going to end up empty handed after all of this struggle. Just as an aside, Pamela, we got married in 1970. We had our first child in 1976. My gynecologist, at every time I went for an appointment, said, Pat, when are you going to have a baby? And I didn't get pressure so much from my family, but I got pressure from my doctor over and over and over again. He said, he didn't say to me, you're not getting any younger, but the implication was, you're married, it's time for you to have a child. And we were deliberately not having a child because I needed to finish my undergraduate degree and then pay back my student loans and buy a house. We had these life goals that we wanted to accomplish. Can you tell our listener about some of the pressures like that or others that couples experience when there is a drop or there's a delay in meeting the expectations that others have around them about when you're going to become a father, when you're going to become a mother? Hey, come on, get on the stick here.
Yes, and this dates back to patriarchal times where, once you're coupled, the next thing you do is to have a child. But in the society in which we live now, women are more focused on their self-development, getting an education, getting a stable job. And by the time they're done with that, they realize, oops, I didn't realize that my egg reserve has dropped or my egg quality has dropped. Um, what is so great now, though, to combat all of that fear of not being able to perhaps have a child when you're ready to have a child, is the medical technology. It's not talked about a lot. Some things are still, not great data yet, even though I was listening to a podcast today about egg freezing. So if you are someone who is coupled or you are busy, developing your career or developing some of your more important life goals at the stage that you're in, maybe in your 20s or early 30s, egg freezing is a great way to do that. You may not need those eggs because you might get to a stage where you can still have children naturally or, with your own eggs. But the pressure is there, and then there are the other population who they're not developing their life goals. They're not in college trying to get their career streamlined. They're married and they're having difficulties, and the pressure is on. And they feel stigmatized. They feel uncertain. They feel depressed. They feel unaccomplished. I would say the first step that you can take is acknowledge that maybe there is an issue, and seek out a specialist to help you diagnose whether there's an issue or not. And then there are so much in terms of technology where you can overcome those roadblocks. And then there are the women who um, they're not partnered yet, and they don't know if they'll be partnered, but their life goal is to be a mom. Then there are other avenues that reproductive endocrinologists can help with, such as the Anonymous Donor Sperm Program, and so on. There are ways, and I say, if there is a will, there is a way. The first thing to do is to acknowledge that there is an issue and then seek out a resolution. Talking, I find, is not something women do well where it comes to their reproductive, um, component of their being. But you never know. You might start a conversation with someone who is going to open up the doors for you. So, it's so multi-layered.
I know that one of the stories in the book was shared by a woman who did hear you talking about the issue of infertility and realized your area of expertise by being part of a spiritual group. I'm fascinated by the people who shared their stories, including their firsthand experiences, made the book uh, relatable and illustrated very effectively the pathway that the women traveled. How did you decide who to approach? Tell our listener a little bit about the process of bringing in those firsthand stories and what it was like for you asking for assistance or answering questions of people as you talked with them about being part of this book.
Well, that particular person in that spiritual group who'd ask a question, I hadn't known her much, and I think that part of it was providence. I do believe that, yes, science and technology have come a great way, but behind all of that, there must be some spiritual hands that move things and set up meetings. I do really believe that, I'm biblical and I believe in spiritual guidance, from our Maker. And so in that particular setting, I had only met her once. I was doing registration and she came up to the table to ask. And then at the end of the semester, then she just overheard a conversation that other women have said. And she asked, right? And that is how information was transferred. And by the time you know it, less than 2 years later, she's a mom in her early 50s. The other women were women who have worked with from their earlier diagnosis to having their baby. And, it's been, some of them have been a couple of years, several years. And, the trust that they put in their nurses is something else. And patients do recognize if this nurse really has her heart in the care that she's providing, or if she's just there just to pass the day, right? So based on how much I put in, and I meet the women at the point of their need. It could be clinical, but beyond that, there is also the psychological, the spiritual, the emotional, the ethical. And I try to meet my patients at those places too. So relationships are formed, trust was built. So when I did ask And I did say, I want to write this book, and this is how I'm thinking about shaping it. Would you be willing to share your story? We wouldn't use your real name. And they were like, of course, of course. And I've not gotten one negative, um, about that. So that's how it got shaped.
Mm-hmm. So nobody said no to you, and they were all happy to be part of that, it sounds like.
Yes, they were happy to be a part of that. They wanted other women to know that, listen, there are hidden struggles. Don't let it seem like there's not. And those hidden struggles are not identified and dealt with in the fertility clinic. You would have to find support somewhere else. It's great if you find it from your nurse, but oftentimes you don't. Um, but there are hidden struggles that need to be addressed to get you through.
Mm-hmm.
So they were happy to share that part. And if you read the stories, you would tell, people did not want to say to their families. People were being stigmatized by. So Melissa and Josh, every time there's a birthday party or a baby shower, the question is being asked, when are you going to do this? Little did they know that they were going through infertility issues. So um, and to the point where she said, there are times when I feel I'd rather crawl into a dark hole, and stay there until the baby shower is over. Um, so those things need to be addressed.
Do you have any advice for somebody who is watching this on our YouTube channel or listening to it in terms of how do you deal with those pressures from friends and family who are looking at you and your spouse and wondering why you're not announcing a pregnancy?
That's a difficult one, because on one hand, you want to maintain the relationship with your friends and your families. On the other hand, you want to keep things private. You don't want to be labeled as barren, or you don't want to be labeled as incompatible with your partner. It's a really difficult place to be, but I think that you just got to pick what you want to hear. It's hard to do, but you have to zone out some of the things that you hear, the comments that are made. Um, Maybe do some meditation. Maybe I believe in holistic, like I said, get some acupuncture, go for a walk, try to not let your mind get so clouded with what you've just heard, or comments that you've made. It's something that everyone needs to work on a personal level. And then if you see anytime you're around Miss Black, she is saying these things, and avoid her.
Mhm.
Um, and if someone is being very pushy, just try your best to avoid that, or make some sort of distinction about your personal life versus your social life, and say it in a gentle way if you can. It's none of your business.
There's always that, isn't there?
Yeah, I mean, the gentlest way you can. I was listening to a group of women on Facebook who were talking about, they were chatting about being recipients and how people ask them questions. And one lady said, it's none of their business.
Hmm.
Sometimes you just got to pick your battles.
You said women were chatting about being recipients, did you say?
Recipients of egg donors, of donor eggs.
Okay.
And, of course, they have these questions, will the child look like me? What if people ask questions? Oh, she doesn't have your nose, or she doesn't have your hair, or something like that. What do you say? It's none of your business.
Hmm.
And I thought, she's probably right. Who are we to judge? I think at the end of the day, we're all cut from the same cloth. Some of us may easily conceive, and some of us may not, and it's nobody's business to judge. You might need to take a different path that they have. I mean, choosing to have a baby with donor eggs is not an easy choice, but it's a choice nevertheless, if that's the only way to have a child. And that it's for women who've had a diminished ovarian reserve, where the quantity and quality of their eggs have diminished. And most of this is age related. Now, what do you do? You have to make hard choices. It's not their choices, it's your choices, so it's your business.
I know there was a story in your book about a couple who felt uncomfortable about letting their family know that this child was not their biological child, in the sense that there was no genetic material from either one of the parents. And yet the grandparents would not have been able to understand this. Tell us a little bit more about that situation, because that is another one of those awkward moments that a couple can get into with the technology that's now available that never used to exist before.
Yeah, and technology plays a big role here in America. But that couple, if I recall, if I'm recalling exactly who you're talking about, is somebody who was stigmatized not only by infertility but came from a total different culture. Right?
Mm-hmm.
That was an Indian couple, and their parents come every year to visit them, just to spend time with their child, and they would not say anything because they didn't think that their parents were culturally receptive, or would ever be culturally receptive to this, because they just did not understand that. So to spare everyone, and they decided not to share it at all, especially when they saw the beautiful bond between their child and his parents, his grandparents. So that was a choice that they made.
Mm-hmm.
And as a nurse, I knew that. But who else knows that? Only the husband and the wife. And if they confided in anybody else, I don't know. But they said to me, our parents don't know, and we'll keep it that way. And a big part of that was culture.
And yet, Pamela, with the rise of the websites that allow you to check into your family history and your parentage and your lineage, isn't it very hard to keep secrets, especially from children, about the origin of their parents? We're talking about keeping a secret from the grandparents of the child. Can you comment on some of those issues when a child doesn't know that the child's not genetically related to either one of the people who he or she thinks of as being their parents? Does keeping that secret create a trouble?
Yes, I mean, keeping that secret does create trouble. And maybe 30 years ago, when IVF with donor eggs was, just emerging, and it was very much shrouded in secrecy, it was not an issue. Now, though, with technology and science and being able to go on ancestry.com and 23 to find that out, is really what will cause a lot of mistrust to a great degree. Because this is not talking about, oh, I left $5 on the counter and someone took it and I think it's you. This is not something like that. This is your DNA. This is your origin. This is your future. And I think that it is going to be very beneficial for parents to start talking to their children at an age where they think that child is going to be receptive about how they're related. Yes, I'm your biological mom. You were, I gave birth to you. You, you know, I carried you in my body and I gave birth to you, and you call me mom and all of that. But the DNA wise, you're not. And there are books out there, there are therapists out there, and this is also emerging on how to talk to children. What age is best to talk to a child about this? How would the child react, and what should be your counter reaction? There are a lot of books that are, not a lot, but I think there are quite a few books out there already. I think that trust is like glass, right? And this is a quote, if it's broken, you could never, ever fix it again to the original um, you know, place it was. So, what do you rather do? Do you rather break trust with your child for the rest of their life and your life, or would you rather bite the bullet take the hard road and disclose this very, very important piece of information, probably gradually, as when they're young, 7, 8 years old, to when they're in their teens, so that they get a more solid understanding and they don't have to find this out on their own when they're in college and or high school and their friends say, hey, let's go take a swab of my mouth and find out my ancestry, to find out that, oh my goodness, this is what happened. And then they're being, looked at differently by their friends, which at that stage is very, very important relationships for them. So I think I address that in the book as well.
Mm-hmm.
This is a real issue. And with technology and science, you cannot withhold this truth from your children. So there's got to be a way to disclose this gradually and then in a more solid form. And I think, once you've developed that love of bond, that love and that bond, it should go well. So nurturing once they're born is absolutely a contributing factor as to how they're going to be receptive of the information eventually.
I think what you highlighted in the book, and it may not be knowledge that everybody has, is how refined the technology has become, to the point that if a man has one viable sperm and the woman has one viable egg, it's possible to create a baby using the technology that we have now. And this has all been evolving over the last 30 years. But until you get into that world, you don't realize the very fine level of sophistication to have a woman in her 50s be able to give birth, to have surrogate pregnancies, to be laid out with all kinds of contracts and plans to deal with the fear that a woman may change her mind after delivering a baby that she's been paid, in essence, to carry inside her for 9 months, for a couple who are paying for that privilege of having her as their carrier. There's all kinds of hope for couples who are struggling with this that never existed before. Can you comment a little bit about that?
Pat, I'm so glad you asked that question. You see, and it's why I named the book, the tagline, The Inside World of Infertility. Once you step into the door of the world of infertility, it's fascinating in terms of technology and what are doable now versus then. Yes, if a man has a low sperm count, remember sperm comes in the millions, eggs come, basically in numbers you can check on your fingers. And there are times when you really have to look for sperm if they have an issue, a male factor. There is that technology called ICSI, which is intracytoplasmic sperm injection. Rather than putting all the sperm in a dish with this few eggs, like millions of sperm to the few eggs, to see which one of this sperm will be the winner to fertilize that egg, you then have the opportunity or the technology, so to speak, to select that one sperm from looking under the microscope that looks normal, that moves normal at a normal rate, and inject it directly into the egg to bring about fertilization. So with low sperm count and low egg count, fertilization rate could still be good, or even greater than 50% of the eggs you would retrieve with that technology. The other thing is choosing to use a surrogate for women who have uterine issues or who don't have a uterus at all. There are women who have had to have a hysterectomy for a reason or the other. There are women whose uterus are damaged from fibroids and scar tissues, adenomyosis and things like that. And they do need to have a surrogate carry their child. There are women who've had so many miscarriages where at some point they don't have an issue getting pregnant. Their sperm and their eggs are good, and they don't have an issue getting pregnant, but sustaining the pregnancy in utero is an issue, and so they need to use surrogacy. There is a lot of legal papers that need to be signed, and psychological evaluation that need to be conducted before a surrogate can be a surrogate, because what if she just takes the baby and run away? What is her ulterior motive for being a surrogate? Some women, they just want to help others. I've read a story of a woman who's had, they've had 5 children of their own, and they were very friendly with their neighbor who couldn't have children. And one night they were out at a dinner party, and the couple who was struggling decided to answer the question from their probing neighbors. Hey, what's up? You guys are not having kids. And they decided to disclose, this is the reason. And that couple decided that they're going to, I think it was right out here in Long Island, in New York. And they gladly, without being paid, carried their neighbor's child.
Mm.
It's one of the greatest gift ever. I mean, her uterus has been tried 5 times. She's not going to have more children. Why not? She said, it's your bun, but it's my oven, and it's okay. We're neighbors. And so she carried that child. There's a grandma who in her 50s carried her daughter's child. Of course, you have to go through maternal fetal medicine to be assessed to make sure that you're healthy to carry a pregnancy when you're at 50, 51, or even older. And she carried her daughter's child. And then there are those anonymous, not really anonymous because you have to know the surrogate. There are those women they just want to make some money, to help with their families. So there are different motives. Nevertheless, they all have to go through the same psychosocial screening, psychological screening, signing consent forms just in case. That is now being legalized here in New York, which I think is a great move, because women do need surrogates at some point for some reason.
And Pamela, I know the person who's listening to this or watching this is going to say, oh, tell us more stories. But we are at the end of our time, and I appreciate you sharing your information. I also know that the person who is listening to this probably knows somebody struggling with infertility and would love to know how to get a copy of your new book. Can you share that information with us, the title and where that would be located?
Absolutely. And I just want to let the listeners know also that this book is not only for people who are facing infertility issues, having trouble conceiving. It's also if you are in a supportive role. So you could be, a friend, a neighbor, a relative, or someone, coworker, and you're in a supportive role. You can just give them a copy of this book. It is called Barren, The Inside World of Infertility. And it is how women have overcome that stigma of being barren by stepping into that world and getting their goals accomplished. It is available on Amazon, paperback, and ebook, and the audiobook will be coming out soon. So Barnes and Nobles and also carry the book.
And if somebody wanted to find out more about you and the services that you offer, what would be the best way for them to be able to reach you?
So I do have a website where I offer coaching, counseling. I help patients with their self-injections for fertility. And my website is Gentle Nurse Infusion 101. So you can find me there as well. I'm on LinkedIn and I'm on Facebook.
Gentle Nurse Infusion 101.com.
.com, correct.
Perfect. Thank you, Pamela. You've been great to talk to. And as you and I worked on this book together, we saw so many stories in the news of people who are now coming forth and being more open about their challenges associated with infertility. And it's great to be able to take this hidden subject out of that closet that people push it into, and to be able to talk about, for many people, giving them hope when they might have felt despair. And I think that's what your book very effectively does.
Thank you so much. And one of the reviewers of the book was Dr. Melvin Turton, who is a fertility specialist, who thought that the book really pulled back the curtains on the secrecies and the hidden things of this world, and he would recommend it to his patients. But Pat, you really helped me along this journey. I know that it was fascinating for you to work on this topic because you've been sending me these stories and, a baby that was an embryo that was frozen for over 20 something years. You've been sending me these stories. And from that, I could tell that you yourself being a nurse and being, a person very knowledgeable about different fields of nursing, you became fascinated over that. And you really, I can tell from the way you shaped this book that you were very much intrigued by the content.
Well, thank you. And I am sure that our listeners will also be intrigued. Get a copy of your book, Barren, The Inside World of Infertility, by going on Amazon and check out the services that Pamela has to offer for coaching and consulting and working with couples who are having challenges. And thank you to you who has been watching or listening to this program. We have an interview every week with a new guest who has written a book, and we would love for you to tell other people in your circle about this podcast, Writing to Get Business. Thank you.
Thank you, Pat. Thank you for having me. And thank you for the way you've shaped the book. It became a masterpiece just by your editing expertise and mentorship. And I really, really appreciate that.
It was a pleasure. We have to work on the next one, Pamela.
Yes, absolutely.